Hi, good morning. Today I'm going to discuss with you regarding transient synovitis of the hip, or we call it also irritable hip. Usually it affects patients at the age of 3 up to 10 years, males more affected than females because they are hyperactive than females at this age. It's common on the toddler age. So what's the presentation? The main presentation is that hip pain, which is referred to the thigh also, and patients usually presented with limping. Usually parents coming to you complaining that their son is limping for one day. He has limping and external rotation of the hip. Usually this was not present and they are worried about the cause, how it happened. Usually the symptoms start to be relieved once we start the anti-inflammatory drug after 24 hours. And complete resolution usually take up to 1 or 2 weeks. After that, the patient should not go for any heavy duties or for jumping or running, at least for these 2 weeks. So what's the main cause of this? Usually it's traumatic and other causes like viral infection. So we have to take history from the patient to exclude any viral infection like sore throat, running nose, to exclude any other causes. But usually these patients presented with history of trauma which happened 2-3 days before coming to your OP. Regarding the investigation, usually we ask for X-ray to exclude any fracture, and then we collect blood samples, CBC and CRP to exclude any infection. In some patients, if there is query findings, usually we go for MRI. MRI will be more specific to detect what is the condition. It's sterile or thick fluid. If it's thick fluid, usually we suspect BUS. And this will go to another investigation and another diagnosis, which is septic arthritis. So in our topic today, which is transient synovitis of the hip, this is a benign condition. And regarding the treatment, most important thing in the first 24 hours to avoid weight bearing on the affected limb. So the patient should lie in the bed flat, non-mobilized for the first 24 hours. Then we start him on anti-inflammatory drug like brufen. This usually we continue for another 2 weeks. The patient should avoid any activities like running or jumping during these 2 weeks. After these 2 weeks, usually he feels better and he can go back to his normal life, and we'll see him in a good condition. Have a nice day.